Today, I'm here with Caitlin Pires, and we'll be talking about the Saskatchewan Health Information Resources Program. Good afternoon. My name is Yvonne Harris. I'm one of the practice advisors with the Saskatchewan Registered Nurses Association. Welcome to today's Wednesday webinar. Today, I am joined by guest speaker, Caitlin Pires. She will be talking with us today about the Saskatchewan Health Information Resources Program, also known as SHIRP. Before we get started, I would like to acknowledge that we are on treaty territory. And as we gather here today, we acknowledge that we are on treaties 2, 4, 5, 6, 7, 8, and 10 territories and the homeland of the Métis. We pay our respect to the First Nations and Métis ancestors who have taken care of this place and reaffirm our relationship with one another. So before we get started, I will go through a couple of housekeeping items. This video is being recorded and it will be available on our social media sites as well as on our SRNA websites. Before we get started also, there are some things that we will ask you to consider as you're watching this webinar, and there are some questions and takeaways that we would like you to consider. The first one is, of course, what is your biggest takeaway from the webinar? And what connection do you see between the standards, entry-level competencies, and code of ethics, and the information presented? Thirdly, are you able to apply this information to your current practice? And if so, consider how you will do that. Finally, at near the end, there will be one little poll question that we will post, and we do ask that you take time to answer that poll question. Now, on that note, I will hand it over to you, Caitlin. Thank you.
Great. Thanks, Yvonne. So thanks again, Yvonne, and thanks for having me, SRNA folks. I'm happy to be here and talk a little bit about the SHIRP program. So as Yvonne said, my name is Caitlin Pires and I coordinate the SHIRP program. So I work for the University Library because SHIRP is a program that's run through the University Library. My background is as a registered dietitian. So like many of you, I am a licensed healthcare provider, slightly different profession, but I find it does help me to know a little bit more about the many professions that do use the program. And I've been in this role for about 1.5 years since the summer of July 2019. So I've learned a lot. It's been a real transition from working as a practitioner. So I know a lot about SHIRP, but if there are any questions that I can't answer right away, I will find out the answer for you, of course. And like Yvonne said, there will be time for questions at the end, but if something comes up as we're going, please feel free to unmute and just ask, because I don't want you to forget about it. I'm happy to just work with whatever kind of questions are coming up for you as we go. So don't be shy to do that. So my plan for today is to tell you a little bit about what SHIRP is, because some of you might be familiar, some may have heard the name and not really know what it is that SHIRP does. So we'll just talk a little bit about what SHIRP is. I'll describe some of the resources that SHIRP subscribes to. I'll talk about how to access SHIRP. So I thought for today, I'm actually going to focus a bit more on the how to access. We're going to touch on the resources, but I'm not going to go into super detail about them because I don't want to overwhelm you. I'm happy to come back anytime and do more webinars and focus on different things and answer questions about resources as you have them. But I thought I'd do more kind of a high-level overview of the program, kind of the different categories of resources we have. And then, like I said, make sure that you understand how to actually access the program because it can be a little bit confusing when you're not kind of familiar. And then of course questions at the end, and I actually have a couple of questions for you, so I'm hoping this can be sort of a two-way discussion. So what is SHIRP? So it stands for, as Yvonne said, the Saskatchewan Health Information Resources Program. It's a really long name. Basically, what we do is provide you access to electronic healthcare resources. So we're funded by the provincial government. They give us this money every year. We do our best to subscribe to as many different resources we can that are going to be as helpful as possible for you in your practice. So our goal is that practitioners have what they need to do the work that they're doing. So it's not just nurses, it also includes physicians, it includes dietitians and massage therapists and all kinds of different professions. So we are trying to sort of please a lot of different groups, but we do of course know that nursing is, you know, a core foundation of our healthcare. And so we do have quite a few resources that I hope are going to be relevant to you. So talking a bit about the SHIRP resources, like I said, we have things that I would call clinical tools. You may or may not be familiar with some of these. So resources like Dynamed and Nursing Central, we'd call a clinical tool. These are ones that you can use. They're sort of, they have a really user-friendly interface, and they're meant for you to be able to use them kind of at work, on the go, to look something up really quick. So they contain different types of information like drug information or disease states to just be able to, you know, you have a patient you're about to see and you need to brush up on some, you know, illness. You can go in and just get a really good overview of things, or certain drugs, that kind of thing. So those two that I listed there are intended to be sort of kind of right at your fingertips, quick, easy to use resources while you're kind of at work. Then I also wanted to mention some tools like the Cochrane Library or 2-Minute Medicine, which is part of our Access Medicine resource. These are tools that can be really helpful. I find in the conversations I've had with practitioners, sometimes folks are looking for the latest information, but they don't want to be reading individual studies, right? Because that takes a lot of time. Then you're just getting that one perspective, depending how big the study was. So what Cochrane Library and what 2-Minute Medicine do is they synthesize information for you, right? So they're looking at the latest evidence and kind of condensing it down, giving you sort of the cliff notes or kind of the overview takeaways. So sometimes these can be really helpful if you're just trying to get a sense of where the evidence is at and not wanting to have to actually go through the literature yourself, which is its own skill set. And again, takes a lot of time to do that. So I'll leave it there. Those are sort of some of those kind of higher level, quick use tools that might be helpful for your day-to-day work or for projects that you're doing. We also at SHIRP subscribe to many journals in and of themselves. So some you might be familiar with, like JAMA, right, the Journal of the American Medical Association, or the Lancet, or things like BMJ, right, the British Medical Journal. Some of these journals you might know the name of, but then we also have like literally thousands more journals that you might not know the name of, or you might, but basically lots of these come in different packages. So that's part of what SHIRP does, is subscribe to these journal packages so that you have access to a wide array of the evidence that's being published, you know, every day. Then we get into databases. So the first type of database I'll mention briefly would be journal article databases. These would be things like CINAHL, Medline, PsycInfo. You might have heard of these before. Basically what these do is they search a pool of journals, right? So they're going to be slightly different pools. The pool of journals that CINAHL searches is going to overlap with the pool of journals that Medline searches, but they have their own focus. In particular for nursing, CINAHL is going to be really important. That stands for the Cumulative Index of Nursing and Allied Health Literature. So that's CINAHL. So again, a lot of that focus is going to be on topics and journals relevant to nursing. And so basically how that works is, you know, you say you did, right? Say you tried Cochrane Library or you tried 2-Minute Medicine, but they don't have that topic that you're trying to research, and you need to look up something, you know, pretty new or pretty niche. And so you head to CINAHL, right? And you put together your search, which, you know, we can talk more about that in another session. We're not going to get into the actual searching today, but basically if you go into CINAHL and you look up a certain topic, right? You know, maybe nursing leadership or, you know, some area of nursing that you want to learn more about, you're going to get a lot of different results. Some of those journals are going to be journals that SHIRP subscribes to, and some of them are going to be journals that SHIRP doesn't. So if we subscribe, easy peasy. You just click on the link. It's a pretty intuitive thing, I hope, but again, we can talk more about that another time. And you can bring up that article, you know, the PDF version, and read it. If we don't subscribe to that journal, that's not a problem. It's not really a barrier at all. All it means is that you just need to request it. So part of what SHIRP offers, aside from all these great resources, is the ability to interlibrary loan other resources, right? Other journals. And so if you're ever trying to access a journal article and it's telling you you don't have access through SHIRP, you don't ever have to pay for it. You would just submit the little request form. And again, it's built into, if you're searching, it's going to kind of help you do that. But if you ever have questions, you can reach out to us. But anyway, so these databases will have a big collection of different journals that you're searching through to find the evidence you need. And you can either have immediate access or we can find you the journal articles. So pretty much any journal article you ever need, we're going to be able to get that for you. We also have a few different databases that aren't necessarily journal articles, but are more related to drugs. So RxTx, Rx Files, natural medicines, these all kind of cover different aspects of different types of medications and information related to medications and therapeutics. So that's a big part of what SHIRP subscribes to as well. So that's kind of a quick overview of databases. We also have a lot of ebooks, many of these being textbooks. So if you're ever trying to study for an exam or trying to get that really fundamental information, Access Medicine, again, I mentioned them earlier with their 2-minute medicine, but they also have a lot of textbooks, and so does StatRef. So again, you can go into either of these resources and take a look at the different textbooks, virtual textbooks that we do offer through them. And then I'll also mention apps. So several of the resources that we subscribe to, if you have a subscription, you can also use their app. These can be, depending on the kind of work you do, you might have access to a tablet or a smartphone while you're working, and it would just be handier for bringing things up, or even if it's not, at bedside. Again, sometimes these apps are just more handy than using the desktop version. Totally up to you, but that is something that's available. So maybe I'll pause in case anybody who is here live wants me to say anything more kind of about the resources and different types of resources that SHIRP subscribes to. So I'll pause briefly. Oh yeah, and that's the other thing I wanted to mention. So even if this maybe isn't seeming like something you might want to use every single day while you're at work, because I know you're busy, actually doing the nursing, keep in mind that for getting your CE hours, right? Or if you're doing some kind of like journal club, that kind of thing, kind of that background information and keeping on top of your studies, related to your CE requirements, SHIRP can also be a really great way to support, those requirements that you have. So like I said, I wanted to spend a bit of time talking about how to access SHIRP. Basically, I'm going to break it down into 2 main categories of ways that you're going to access. And it's going to depend, are you an SHA employee or are you not an SHA employee? So basically, with the SHA, SHIRP has a partnership with the SHA. So all those resources that I just mentioned, all those databases and journals, everything that SHIRP subscribes to is embedded within the SHA's online library, right? Because we have a partnership. We know that many of the nurses, many practitioners are working for the SHA, and we want to make access easy. And so if you are working for the SHA, you can just log on to one of their computers and go to, navigate, I'm assuming it's through the intranet, navigate to the SHA's online library, and then you would have access to all of these resources that I'm mentioning. So in that case, you would just, again, log in with your SHA credentials and have access to the resources. So that's if you're with the SHA. If you're not with the SHA, you're going to use the SHIRP website to access the resources. In that case, the credentials you would use, you would kind of make up yourself, right? So you apply for a SHIRP account, you make up a username, you make up a password, and then those would be the credentials that you use to then navigate to SHIRP's website, which is shirp.usask.ca. And then you would access all those same resources through our website. So again, that's kind of the key difference, because I know we get a lot of questions regularly from, nurses and other practitioners who are working for the SHA, kind of wanting access to things. And you are welcome, like even if you work for the SHA, you can still make a SHIRP account if you want. But depending on, kind of the practicality of what you're doing and when you're accessing it, if you're at work, you're probably better off just using, again, the SHA's website to access the resources. The SHIRP website would be for those, you know, if you're working for a community organization or a tribal council or some other place where you don't have access to the SHA's website, then you would use the SHIRP website. Again, stop me anytime if I'm not making sense. Yes, I'll also mention kind of this idea if you wear different hats, right? So you might work for the SHA, but maybe you also lecture, you know, at the U of R or at the U of S, or you kind of have multiple affiliations. What you want to do is use whichever one's giving you more access. Okay, so if you have access, you know, say you're thinking, oh, I'll just use the SHIRP website. If you work for the SHA, you're actually going to have all the SHIRP resources that we embed, plus the SHA has some of their own resources. Okay, and that's the same goes with the University of Saskatchewan or the University of Regina. If you also have privileges with those libraries, you'd be better off to use those libraries because they have more resources, right? So, and I didn't actually mention this when I was doing the SHIRP intro. All the SHIRP resources are a subset of what the University of Saskatchewan has. So we kind of pick and choose from what they offer, and we're able to offer a subset. And so again, if you end up working or being a preceptor or something with the University of Saskatchewan, and you have access to those resources, you'll have everything that SHIRP has, plus everything else that the University of Saskatchewan or University of Regina or SHA has by using their library. So SHIRP is kind of, it's sort of the backup plan in a way. It's sort of to fill in those gaps and to support these other libraries. So I hope that that makes sense. You can, again, of course, reach out anytime if you want some clarification on what the best route to go is for accessing resources. I thought I'd just give you sort of a visual. So this is just a screenshot from the SHA's library website. So that's at saskhealthauthority.libguides.com. This would be, if you're at work, you'd be able to navigate here. And if you see kind of on the left, kind of near the bottom, it says key resources and it lists a bunch. You'll recognize some of those names, right? Those are titles I was talking about: CINAHL, Cochrane, Dynamed, Medline, Nursing Central. Those are all SHIRP resources, right? But then they also have some there that I didn't mention. And those are ones that the SHA has, the SHIRP doesn't. And so feel free to navigate to this website, whether you're at work, you can use this, or you can also contact the SHA. It says right here in blue, kind of near the top, working from home, get a barcode. So you can also access the SHA's library if you're not on site, right? You just have to contact them, get a barcode, and then you'll be able to, you know, do this from home or wherever. You can also get a SHIRP offsite account. So if you're at home, it's kind of up to you. Do you want to use the SHA's website? Do you want to use SHIRP's website? Totally up to you. But just know that when you're at work, you should use the SHA's website if you're an SHA employee. This here now is an image of the SHIRP website. So I know there's a lot of similarities if you look between the two. They're both a LibGuide type website, which doesn't really matter to you, but just so you know, they're going to be very similar to navigate. This is shirp.usask.ca. So again, this is where you're going to go to get your own SHIRP account if you're not with the SHA. And so you can see it's quite busy. We're actually working on updating the website. So in the next few months, it's going to look different, but there will be lots of warning and tutorials and that kind of thing. But if you look on the left where it says welcome to SHIRP in black, under that is login, sign up. So you would just go right there to sign up for your SHIRP account. Again, if you're not with the SHA and you want to be accessing these resources. I hope that makes sense. Okay, so I've actually sort of sped through a lot of this. I guess then I'll open up the floor because again, it's like I don't want to, I just want to make sure that we're kind of all on the same page. I don't want to overwhelm anybody with information. So I'll ask you now, what did I miss? What can I talk more about? What would you like to learn more about, if anything? So I will pause now because I know there are some folks here live with us.
So Caitlin, it's Yvonne. I'm just confirming. So there is no cost to join up with this. It's free access, which is
exactly
fabulous. Okay.
That's exactly right. So we can thank the provincial government. They fund this program every year, and they have for the last, I think it's about 10 years now. Okay. Yeah. Thanks. I didn't mention that explicitly. So yeah, exactly. No cost to using any of this. Okay, so then maybe I'll ask, in case anybody wants to pipe up, you can go in the chat, or you can just unmute yourself. Are you already using SHIRP? Are you using SHIRP resources? Are you familiar with this already? I'm curious. Or is this brand new?
I'll keep my eye open on the chat. I don't see anything
Perfect.
so far. I will say I do use it. This is a hidden. This is a hidden gem.
Yeah.
That I'm so glad that we're getting it out there.
Yeah, that's great.
So there's one person in the chat has used it before. Jolene has used it before, but this is a good refresher for her. So
okay, that's good. Yeah. So is there? I'm curious if there's key, certain resources. Like which of these kind of stand out, or what are you using, or what might you use? Something familiar. Right. Okay. So good. I mean, I'm glad to hear that it's, it's on your radar, and perhaps this is like a nudge to just remember that it is there for when you can use it. And yeah, I'm curious about, maybe which resources in particular sound like they would be useful to you, or is there something that you know about that I didn't mention, right? A type of resource that we should be offering that maybe we don't. I'm curious, what you think would be helpful for your practice. If anyone has ideas.
One of the databases that I used often when I was in some of my post-secondary, the TRIP database.
Yep, great.
And there's the Joanne, I'd have to think of her last name. It's another database.
Oh, okay.
But yes, but the TRIP database I found was.
Yeah, that is a useful one. Yep, great. So I do find, like, for instance, Nursing Central, depending when participants here were in school, but I know now Nursing Central is part of the nursing curriculum. So all the different programs in Saskatchewan are using that. So again, it might be something that's more useful in the post-secondary context, right? When you're doing more of the research and studying as opposed to the day-to-day actual, the practical work of nursing. So that's always an interesting element too, right? Kind of which resources are, do you keep using after you graduate, and what, sort of is no longer kind of as relevant.
One of the other questions I had was, I know you had talked about access to the Access medicine, but they also have some subsets, for instance, emergency medicine. Do we have access to those also?
Yeah, exactly. Yeah. So we, yes, everything that's part of the Access Medicine kind of catalog of resources, you'll have access to. So I mentioned 2-minute medicine, but yes, there's several in there, and the whole thing is accessible for SHIRP members. Yeah, great question.
I think this is so important to have this access with all of the frequently changing information on coronavirus and COVID, that people, to have the most current information, scholarly information will be such a valuable.
Yes, and the SHA has done some really great work over the last year, putting together different, what's the word I'm looking for? But basically just putting together the latest evidence on all kinds of different topics within COVID, and that's all accessible. If you go to the SHIRP homepage, we've linked right to that, and of course it'll be on the SHA's website as well. But on the SHIRP website, we do have a COVID specific link. You can see it on the left-hand side, and yeah, it's put, because lots of vendors too have taken away paywalls, right? Where in the past you would have to pay to access their resources. During COVID, they've made a lot of information freely available to just aid in, of course, doing our best to control and manage the situation. So yeah, COVID's a great example of needing to stay on top of it for sure.
And earlier in the slide, you talked about CE hours. With the SRNA, we have continuing competencies.
Continuing competency, okay, yeah. So the language is always a little bit different from group to group, but yeah. And is that, because my understanding is, because again, different colleges will have different, not standards isn't the right word, but just different rules around what is allowed and what isn't. But I think with the SRNA, they can do some, like reading journal articles and doing research, and
It's very, very,
Yeah.
absolutely. They
Mhm.
can use that as towards their continuing competence.
Yeah.
At the very beginning, as I say, we had asked the audience to be considering, how does this apply to your entry level competencies, your standards,
Yeah.
and code of ethics, and um, being familiar with some of the evidence-based practice is a tremendous part of that.
Absolutely.
So this
Yeah.
definitely is applicable.
Great. And some folks might recognize my name. I am part of the Timed Right, the online community. So I'm in there, and I posted promoting. This would have been a few months ago now. We offered CINAHL training. So CINAHL is owned and run by a company called EBSCO, and they have their trainers that can come in and do workshops on how to search. And so we had offered that, and several nurses took part in it. We can always offer another one because I know, so in my role as the SHIRP coordinator, the person who used to do this job was a librarian, right? And so they had that was their skill set and their background to offer those. So part of what I'm doing is, of course, learning a ton about the resources and that work as well. But basically, yeah, part of bridging that gap would be bringing in these experts who can offer that training. And so I'm happy anytime to also set that up if more folks think that would be helpful to just kind of get a refresher or learn more about how to search the databases. I see a question just come in.
Yes.
Other than SHA or universities, what other organizations can access SHIRP? And do you have to be a regulated professional to get an account? Great question. Thanks, Erica. So you do have to be a regulated professional to get a SHIRP account. This is a whole sort of, I'll try and answer this concisely. Basically, if you work for the SHA, you don't have to be a regulated professional. So if you work for the SHA in any capacity, any SHA employee is going to be able to access SHIRP resources. And the same thing goes for Sask Polytech and the University of Regina, and then of course University of Saskatchewan, because they, own all of these resources that we are kind of piggybacking on. So those are the organizations, those are the main sort of organizations. We also have a partnership with the Health Quality Council, which sort of fits their kind of part University of Saskatchewan, part Health Authority, but they are sort of their own organization. And now I'm just trying to make sure I'm not missing anybody. As well as the government. So if for some reason we're working for the Ministry of Health, or if you're working for eHealth, they also have sort of institution level access. So if you're an employee at any of those places, or a student, if you have an affiliation with any of those organizations, so both of our universities or Sask Poly, Health Quality Council, the Cancer Agency, which is part of the SHA, but again, they're sort of have their own kind of separate thing going on, but the Cancer Agency as well, or those kind of health related government agencies. You'll have just access just by being part of those organizations. Otherwise, if you want to get an individual SHIRP account, you do have to be a regulated professional. That includes, I think there's about 30 different professions that are considered to be licensed in the province. And so that is a pretty wide swath. But I hope that answers your question. So that's kind of how access is set up, right? So either the SHIRP account or with your institution. And if you don't fall under one of the institutions, you'll need a SHIRP account. And to get a SHIRP account, you have to be a licensed practitioner. Let me know if I didn't answer your question, Erica. Oh, you're welcome. Yeah, so anything related to, getting registered for an account or accessing, or, if anybody would be, interested in training on those databases, or, in the future, learning more about any of the resources or anything else about the program, I'm happy to answer any questions or plan for more sessions together. And like I said, I am in the in your online community as well, so you can always tag me there to ask questions. I'll also perhaps move my slides along to, I guess maybe you're seeing that, sorry. Yeah, so there's my contact information as well, so you can always follow up with me. There's also, if you go to the website, of course, contact information listed there as well.
So another question has just come in, and it asks, does SHIRP offer library assist with searches?
That's a great question. So unfortunately, SHIRP doesn't, because again, myself in the SHIRP coordinator role with my healthcare background, I don't actually have those librarian expertise to be able to do that. And we don't have a librarian who actually works for SHIRP. And so if you are affiliated with the SHA or one of the universities, they'll be able to help you with that. But unfortunately, if you're not affiliated with one of those other organizations, we don't actually offer those searches. Yeah, good question. But again, we are happy to help you set up training to know how to do the searches.
So I'm not seeing any questions right now, but I think I might put the poll question up just while we're still talking and waiting to see if there are any questions. And the poll question is, did the webinar provide information or resources to support your practice of safe, competent, ethical, and culturally appropriate care? So I'll just leave that up here for now.
Great.
I just want to say this is a fabulous resource. So many of us have, been gone to school in the past, but we're not currently. So we had access to the university libraries, and
yes,
now you're in the workforce and you're still curious. You want to keep learning. You want to do that,
yeah,
but don't always have the access. So
it's very true.
Your ability to provide that valuable service is so appreciated.
Yeah. And we're lucky in Saskatchewan, like most provinces don't have, and like some of them will have similar things, but you have to pay to use it, that kind of thing. So Saskatchewan is quite unique. We're kind of one of the first to set up a program like this. So it is kind of special. And I can totally relate. When I graduated, I was working as a community dietitian with sort of non-profit, non-government, non-SHA organizations. And I didn't know about SHIRP. And I was always, kind of scrambling and trying to find, resources and information, and not knowing that I had this great kind of resource available, because it is one of those things. I think when you're a student, you just sort of take for granted, right, that you have access to all of these really wonderful, expensive resources, right? They're just there, and then suddenly they're just not.
Yes.
Yeah.
And is it valuable? You say it's in Saskatchewan, but if a registered nurse lives in Alberta or Manitoba or Ontario, are they able to sign up with this?
No, not with SHIRP. So you have to be in Saskatchewan. Yes, exactly. Yeah, that's a great point. This is only for folks who are licensed and practicing in Saskatchewan, and that's because of our vendor contracts, right? So we basically sign, we pay them and we sign contracts saying, we have to keep track of the numbers, right? So that's why I've been, I'll bother folks at SRNA every year to kind of get updated numbers and checking out annual reports and that kind of thing, so that we can accurately tell the vendors how many people are using this. And it's very expensive to do so. So that's another thing to just keep in mind, is again, just being, again, grateful that our government is funding this, because it is something that if we, if the SHA was trying to do this, and, individual practitioners, you couldn't afford, right, to get access to all of these resources on your own. So yeah, indeed. So it's we can only cover those who are in Saskatchewan.
Good to know. Okay. Well, I don't see any more questions, and I just think that I would like to thank you for taking time out of your day to talk with us and to meet with us. It is appreciated, and we would love to have you back to talk about different components.
Anytime. Yep.
Okay.
Anytime. Yeah. And like I said, you can always find me as well in the online community too, if you wanted to follow up about, questions that you have, or resources that you want to learn more about, because we can certainly do that in the future, anytime.
Thank you so much.
Thank
and
you.
As I say, your contact information will be, because this will be posted on our social media sites.
Yep.
So
great.
And on Timed Right. Thank you very much, Caitlin.
Great. Thank you. Take care.
Bye.
Bye.